Hello friends of Virtuoso IQ. Today we will discuss a topic of vital importance: prostate cancer. We will provide answers to questions such as how many men are affected annually by this illness? How many die because of it? Is it possible to prevent it? Is it also possible to have an erection if you have been diagnosed with prostate cancer? Is it possible to impregnate a woman after you have prostate cancer? Can you ejaculate after having a prostatectomy? What is a bilateral orchiectomy, and how does it affect your ability to procreate children? According to reports from the Cancer Institute and other organizations, more than 1.5 million men are affected by prostate cancer every year, and more than 375,000 men die as a consequence of it. The specific causes of prostate cancer are unknown. However, the following factors increase the risk of developing. First, genetics. Some people inherit faulty genes. Secondly, others have greater risk as a result of family history. If a grandparent, a parent, or a sibling have been affected, your chances multiply. Age is another influencing factor. Men older than 55 years old present greater risk than younger ones. In fact, according to the Cancer Institute, 60% of all cases of prostate cancer are diagnosed after the age of 65. While it is true that we do not have much control over aging or what we inherit, no less true is that we can control what we eat. Ingesting a balanced diet free of dairy products, red meat, and saturated fat reduces the risk of developing prostate cancer. Alcoholic beverages, wines, beers, and liquors of any form also increase the chances of developing prostate cancer and other health problems. The same is true about smoking and chewing tobacco. Numerous studies reveal that obesity is another factor of consideration, as well as environmental pollution and hormone disorders resulting from overdoses or nutritional deficiencies. The last factors that influence the development of prostate cancer are race and ethnicity. Black men and men from the Caribbean have the highest probabilities of developing prostate cancer, followed by white men, Hispanics, and people of indigenous ancestry. The main symptoms of prostate cancer are difficulty urinating, which could manifest by a weak urine stream, presence of blood in the urine, as well as presence of blood in the semen. Also, bone pain, involuntary weight loss, erectile dysfunction, and the inability to impregnate a woman. Among the treatments, we have radical prostatectomy or removal of the prostate gland and seminal vesicles. After recovery, some men may be able to sustain erections but will not be able to ejaculate semen or sperm. That is what is called dry orgasms. If a person chooses to have an orchiectomy or removal of one or both testicles, the production of testosterone stops and the cancer growth is somewhat slowed. An erection can be achieved, but procreation is not possible unless the subject have banked some sperm prior to surgery. When radiation is chosen, there is a risk of erectile dysfunction and the chances of procreation are reduced because the semen is unable to transport sperm properly. Finally, there is also hormone therapy or ADT, in which case the body stops producing male sex hormones such as testosterone, but of course a derivative is that this affects the sperm and the ability to procreate. Friends of Virtuoso IQ, the risk of developing prostate cancer can be minimized if not avoided altogether. Prevention mechanisms include the avoidance of nutrients that are high on saturated fat, dating, and also eating red meat. Conversely, ingesting a diet that is rich in fruits and vegetables, and of course, having a yearly prostate exam. I am not referring to the rectal exam. Instead, I am suggesting the PSA or prostate specific antigen test, which serves as a barometer while we eat a balanced diet. Let's keep in mind that an ounce of prevention is better than tons of intervention. Please subscribe to my YouTube channel, Virtuoso IQ 1793, and receive automatically each one of the videos that we produce. Thank you for the privilege of your time and attention.